So we have discussed the conservative management in detail, and now we will be talking about the medical management of ectopic pregnancy. So how we are going to explain it to the patient? Now we tell the patient that in certain circumstances an ectopic pregnancy may be treated by medication. Okay. For example, if the conservative management is not working, or if the HCG levels are not decreasing and they are high, and the heartbeat on ultrasound is also not present, so we can give medicine, and the name of this medicine is methotrexate, if you have ever heard about it. Now this drug, which is called methotrexate, prevents the pregnancy from developing, and so the ectopic pregnancy gradually disappears. And how is this drug given, by the way? How about you all think about it in your head? How is this drug given? Basically recall some knowledge. So this drug is given by intramuscular injection. Okay, so this injection is given in the muscle. So you address the patient again that if your pregnancy is beyond the very early stages, or the HCG level is high, very high basically, then methotrexate is less likely to succeed. Okay? Many women experience some pain in the first few days after they receive this injection, but again, the over-the-counter pain relief medications can be taken, like paracetamol. After getting this injection, okay, sorry about that, you may need to stay in the hospital overnight, and then return to the hospital a few days later again, or you might have to come to the hospital earlier if in case you present your symptoms are getting worse, or you experience any new symptoms. Okay, another thing which is very important after getting this medicine is to come to your follow-up appointments. Okay. Yeah, apart from this, now most women, they get one injection, but in a small proportion, about 15% of the women, they might need a second injection of methotrexate as well. Okay, and even a smaller proportion, which is I think around 5%, 5 to 7%, they may end up needing a surgery. Now, other things you might want to keep in your mind when talking about methotrexate are that before giving methotrexate, the patient has a normal, she gets her full blood counts done, renal functions, liver functions. They're very important, and they need to be normal before the treatment. Okay, and you tell the patient that she should be compliant with the follow-up. It's very important in case of this injection. Okay, another important piece of information that you need to give her is that she should not get pregnant again for at least 3 months due to the potential teratogenic effects of this medicine. Okay, other side effects may include abdominal pain and nausea and diarrhea, or dry mouth, so stomatitis, conjunctivitis. So these symptoms may be experienced. Okay, again, the important point is to emphasize that the patient needs to use a reliable contraception or emergency contraception for at least 3 months after the treatment. Okay, because methotrexate can be harmful for the baby if you do become pregnant during this time. Also, it is important to avoid alcohol until the patient is told that it's safe, because if the patient drinks alcohol soon after receiving methotrexate, it can damage the liver. Okay, so these side effects, like they occur more commonly when the patient is on a long-term treatment, But because with this ectopic pregnancy you get 1 or 2 injections, then these side effects, they are rarely seen. Okay. However, again, the point again, contraception is still important, at least 3 months. Okay. Okay. Then we are going to talk about the surgical management in the next video.